to get into getting y'all some more money for 2025. So before I even get to it, y'all know how I do. I always check to see if you can hear me. So I'm on my laptop and I want to make sure that everybody can hear me before I start getting into the details. So let me click and see if the volume is okay. I got my mic on. And we will get into it. There we go. So I wanted to discuss, of course, these 10 six-figure earning jobs for nurses. Of course, full disclaimer, when you are a new grad, you're not going to make six figures unless you work your butt off at the bedside and you have a high-paying state like California. But this is for work from home. This is no overtime. This is just your regular hours. So let's get into it. So of course, let me make sure that everything is lined up. And hello, everyone. You can say hello while I'm talking. And if you need to ask questions, feel free to do so. It'll be in the chat. I'm looking at them. That's why I have my computer right here. And forgive me for the Thanksgiving guts. But we ate good yesterday, right? It's Black Friday. And I'm going to throw a little business, what do you call it? I just went blank. I'm going to do a little business, my own business plug in there. So I'm going to put this in the chat. And all of my scrubs that I sell are currently 50% off at checkout. This is for Black Friday. I have put the link there. Originally, my link is pettyscrubs.com, but something went on with GoDaddy, and I don't know what happened to my actual domain. So I'm trying to work with them to get it back, but this is my raw Shopify link. Everything on my website is 50% off. It don't matter if it's a $1 highlighter or it's an $80 scrub set with the jacket. So I wanted to give that to y'all, as well as everybody that's already purchased from me. Y'all got an email burst or a text burst today. Okay, so when we're talking about six figures and you think about nursing, I want somebody to say this first before I get into it. When you're thinking of six figures and nursing, what do you think of when you think about, I'm going to get a job working from home to do this? Put it in the chat. What do you think of first? Six figures, a nurse. What do I have to do? You know, if you've been on my lives, we interact. So I need some interaction. I see it's a few people on here right now. Somebody put in the chat, and thanks for that like. Appreciate the likes. Out of 15 people right now, somebody can't be shy. I'm just getting in, so I'll give y'all a time. Okay, Rochelle, consulting. That's a good one. It's not on this list, but that's a good one. I'll give somebody else another chance to say something. Thanks for the other likes that I'm getting. But consulting, you pretty much, if you're really good and you know how to market yourself, you can write off how much you're worth, just like those legal nurse consultants. That is a good one. Thanks again for some more likes, guys. I'm going to give somebody else a chance to put another comment in the chat, and then I'm going to go with number one. Everybody is going to be like, oh, yeah, of course, when I say number one. But it's 9 other ones there that will show us how we can make money as a nurse, get some time under your belt as a nurse, as well as being lined up in the right place. Now, you know it says remote nursing jobs that pay $100K, right? Remote, work from home, no bedside. Anybody else want to see what's going to be number one for working from home jobs? Or anything on the list. It doesn't have to be number one, but if you're too shy, it's okay. I'll give you a few more seconds and then I'll get into it. Now, I do have them written down because I don't want to forget. So that's why you see this paper that's in my lap, and I'm going to get into it. So it looks like Rochelle was the only person that wanted to say something. Maybe the other ones is like, I'm just going to listen and be quiet. I've been there. So, of course, number one is nurse practitioner, right? That's a given. So, when you think of nurse practitioner, there's telehealth. There are plenty of telehealth nurse practitioner roles. It's some in behavioral health. It's some primary care telehealth positions. The majority of them, it may be a combination of both. Appreciate the likes, appreciate that. But with, of course, nurse practitioner, you're a provider, you're an advanced practice nurse. So they give you the autonomy to work from home, as well as you got a master's. You better get paid a good amount of money with your master's. A lot of these on this list don't require a master's either. So, number one is nurse practitioner. All right. So, of course, if you don't know, let me just break it down. In order to be a nurse practitioner, you have to go to school to get your master's in nursing. Most of the time, these nurse practitioner roles are going to pay, depending on where you are, they're going to pay at least 90,000 to start. And for nurses that already make that, it's kind of like, okay, I want to make a little bit more than that. So just know where to apply. And if it's a place that you already work that will allow you to level up in a different role, they'll keep what your salary is. Say, okay, an example. You're a nurse at a hospital. You've been working at the hospital for a year or two. You finish an NP school. You level yourself up, but you staying in that hospital. They're going to look at your rate of pay, and they're not going to go down for you being a provider. They're going to add more. So it becomes a benefit if you want to do it like that, right? So say you make $95,000, you become an NP, you start working with them, they give you a $10,000 increase. That's $10,000 more than what you had, and you don't have to even do overtime for it. So that's good. Let me see. Rochelle starting DNP fall. Oh, nice. Good job on that. I'm taking my behind back to school next year too. I was waiting to see if my job would pay for it, but I'm hearing a lot of mixed reviews on that. So I'd rather just pay for it out of pocket, go back to school, and not really be tied down to a place that possibly, they hire you and say, oh, well, yeah, we're going to pay for your school. Anything in nursing, you get an upgrade, we'll pay for it. And then you have to work for us for X amount of years, which I'm already getting paid a good amount of money. But what I'm doing now is not enough. So I believe that me leveling myself up as a provider, a nurse practitioner, leadership, education, whatever the case may be, to get my master's, I'll feel more comfortable as a nurse, meaning that I'm not stagnant and feeling like I'm wasting my time or I'm going backwards. I definitely need to push myself, because if you looked at my channel, I was in NP school a couple years back, and I dropped out with a 3.89 GPA. And I was going through some stuff, and I needed to take myself out of school so that I could take care of the other things. And then I wasn't feeling it like that. So I also went to travel nursing, and I travel nursed for 3 years. So I was making the money of the providers as a travel nurse. But now that all of that stuff has died down, I'm like, okay, let me figure out what I need to do with myself. A couple of my children have went to college, so it's starting to sit in my mind. This ain't it what you're doing. You can do better than this. You could do more than this. So I'm going to take my behind back to school, and hopefully the credits that I have, I'll transfer them somewhere, or if it's in the time frame of what I'm trying to do with that school, they should be able to, come up with a plan for me so that I can graduate in a quicker time than expected. Okay. Job for 9, ditto. Rochelle, I'm with you on that. Yes. Objective is mental health, NP, and work from home. It's a lot of people that's doing that. It is. Actually, I call her my nurse sister, but my nursing school friend, she literally texted me, not yesterday, maybe Tuesday, and was like, oh, when I was in NP school, she was like, no, I'm not trying to do that because they laying NPs off because her sister-in-law is an NP and she had to work as an RN during the time of the pandemic because she was laid off. So she was like, oh no, I don't want to do nurse practitioner because there's no jobs out here. Me, I know that the company that I work for hire multiple NPs. So if I was to go to school, complete school, become a provider, I know that I will have a job, no problem. But if you're not in an environment where you see nurses going from RN with their BSN to NP or leadership or education, however they want to do it, and you just see people working at the bedside, you know, you'll think, okay, well, all I have to do is level up and get my master's to get $100,000 a year. But that's not the case. That's not the case. You got to line yourself up with the right jobs, because I've mentioned on this channel, I already make 100,000. I do. So, and I only have a bachelor's and I'm not doing any overtime. I'm working my regular hours and I'm working for a regular company. But if you don't know how to research and put yourself into the right place, you're going to be making 60, 70,000 and you're going to be a nurse for 8, 9, 10 years. It's like, no, level up. Okay, let me get to it. So number 2, I'm going to talk about is a clinical documentation specialist. So have anybody heard of CDI? Let me know in the chats, yes or no. So with this clinical documentation role, this is something that you can get with no masters. You don't need a master's. You just need to be a nurse. And what this does is going through patients' records, as well as there is you have to have accurate coding. So when it comes to you getting some type of certification, you want to make sure that you have it's called CDIP or CCS certifications. These are going to help you to get those roles, because if you were to go in Google or LinkedIn or Indeed.com and type in CDI jobs, this is all nursing, there are going to be some jobs out there, and the majority of them, if not all, are work from home that you see. Now, you have to do your research to make sure that you get a good amount of money from them, because to start, if you're a new grad or if you've been a nurse under 5 years, they want you to have more clinical judgment, and you have to set your resume up to where you look like you're a well-rounded nurse. Myself, my background started off in the ER, worked in the ICU. I've been a nurse supervisor in dialysis. I also did travel when I did case management. I was doing case management as a staff nurse, but then I went into travel. I did case management for quite some time. As well as when I traveled, I did ambulatory care, infusions. I accessed PICS and porch trialysis. I was transitioning into learning more oncology. So the travel world, if the people are desperate and they need you, they'll train you. So I've worked in other areas. So if I was to review a chart as a CDI specialist, I would kind of know the critical care, the trauma, some oncology things, the dialysis patients. I would know, in ambulatory care, I would know infusion, all of that. I would know that stuff. So you can't go into these 100K jobs without having that on your resume and that knowledge, because they're going to look at you like, oh, okay, well, we're going to start you off at whatever that's under 100,000, because they want you to have more knowledge. Not saying that as the years go by, you won't reach it, but you won't get it right off the bat. Okay. So number 3, this is something that my aunt is a nurse, and she has her, she has more than a master's, she has her MBA. She has her master's in business administration, and she's a nurse. She's been a nurse for over 40 years. She does this. She is a nurse informatics. She was, management at a point in time, and then some things happened and she stepped down. The good thing about nursing informatics is there is work from home jobs all over the place. Okay. Of course, you need to have your master's in order to take up this role. And if you look at classes, you probably can do classes online to obtain the master's and apply. But the critical thing that informatics nurses are is they're a bridge from healthcare and technology. So they optimize electronic medical records, health records, as well as other systems, and high. They have very, very high demanding salaries. So they're not going to allow you to, work as an associate's degree nurse and get into informatics if they're going to pay you top dollar. They want you to have more education of a background, more nurse judgment, more time as a nurse. And most nurses that I know that have reached a certain point in nursing, they get burnt out from the bedside. So you always want to look and see, where should I go next? I don't want to give up on nursing, but I do want to give up on the bedside. My body is tired. My feet hurting, my legs hurting, my back hurting. You can't do nursing like that because it's different out here. You can if you want, but I'm not. Okay. Job for 9. This is gold. Thank you. Beverly, you know what? You said my outfit is inappropriate. I apologize. I have a full body jumpsuit with a little sweater on top. If it bothers you, I apologize, but I'm grown. My husband approves of whatever I wear. So thank you for your comment anyway. Okay, so let's get into what I do. Number 4 is a case manager. Now, I'm going to give you the breakdown of the work from home case managers, which ones get paid more than the other. So I've worked from home for a little bit during the pandemic at a staff job. I've been offered a remote case management position as a travel nurse, which was on the lower end. I've been also offered a position when I was traveling, but I declined it. It was with a major insurance company, and their pay was terrible compared to what I was used to. So, like, to give you an example, the pay for one of these major insurance companies was like $40 an hour. No, not for a contract. No, your contract should start at about $50 an hour. I don't care if it's work from home or not. Do not take anything less than $50 an hour if you're on a contract. You're not hired into this place. You're not getting benefits. So you need to get paid more. But that was just my take, right? So with case management, I work case management in the hospital, and I do several things. Of course, everybody is short, right? Staff is short. So for me, I do different things. I give injections. I pull medications for the doctors for them to do certain things. I call to confirm appointments. I follow up with patients. I request, I just tell the providers, I don't do medication refills because that's out of my scope as a registered nurse. With a bachelor's, I don't have my master's. I'm not an NP. I'm not doing any of that because it's out of my scope. I don't get paid to do that. I will request for the providers to do it, but that part of case management will get you $100,000. Now, there are case managers that are work from home at hospitals. Those usually are the ones that are higher paid. I work in a hospital, so I'm not remote. The remote opportunities that I've seen weren't high enough for me to leave what I was currently in because I was travel nursing back then. Now I'm pretty content where I am, but I'm going to go back to school next year. And a 6-figure case manager, usually you'll get that from a hospital. When it comes to the insurance side, they will pay you a pretty decent amount. If you are going through a company, that's an insurance company, they should give you some good benefits. I mean, if you're working for an insurance company, let's say Blue Cross, your insurance should be nothing, right? You should be getting paid and not paying anything for insurance. I did have a friend or two that worked for them, and I'm not 100% sure if their insurance was free, but a lot of them started off as contractors, meaning no insurance. You got paid a little bit more, but when everyone gets the bonus, because they give bonuses at Blue Cross, I don't think they got the bonus because they weren't a part of staff. But they did get hired in after so many months. And, you know, it was a quota that they had to reach, whatever that was. They achieved it and they got hired in. Okay, so, but the requirements for a case manager is just a simple nursing license. If you have your bachelor's, that's perfect. Having that nurse knowledge for so many years so that you can navigate through church and figure out what's wrong, because sometimes you are, well, all the time, you're pretty much the doctor's backup. You're navigating to see if it's any errors, if something was missed, if something wasn't scheduled. That's your role. So you need to know the ins and outs of nursing in that department that you're in so that you can catch the mistakes and make sure that they're corrected. So when you bring it to your provider, you can say, hey, I caught this mistake done on this one. Did you want them to do this, this, and that? Or would you like them to do this? And then you're coming up with the problem solving and letting them do the solution. So it's more so of you helping them with the right idea, but it's automatically going to be their choice whether they do whatever. So, yes. So, of course, more experience in case management, you get $100,000. 100%. You can get a certification. I don't have one. It's not really a requirement for me because I've worked in case management. But if you want to get a CCM, you can. And that'll make you look that'll make you look better than just someone random without that certification and that doesn't have case management experience. Okay. Any advice on becoming a psych nurse? Noah. Are you a nurse right now, Noah? If not, go to school. You would just go through regular school like that. Okay, so you're not a nurse. So Noah, you go to school. If you want to get your associate, you can. If you want to get your bachelor's, you can. But mental health, the mental health specialty, is not going to really be a part of your nursing. It's not going to be of your curriculum. That part, when you get your degree, so say you get your associates, you do 2 years, get your associates, you apply for mental health, right? That is going to be something that you learn on the job. When you get your foundation, your fundamentals, they'll tell you what you need. But when you need to get into specialties, you have to apply for it. If you want to get your bachelor's for nursing, same thing. You get your bachelor's and then you apply for mental health. Now, the only difference in getting into mental health for NP is they have specific training for mental health. So you can be a psych NP. But if you're going just for your associates or your bachelor's, you just take your regular curriculum for nursing and then apply for it. Hopefully that's helpful. All right, so let's get into number 5. Number 5 is a health coach. So with health coaches, oh, okay, Rochelle. I did have psych clinicals. I'm going to tell you that. We did a psych class, but it wasn't like how you get your master's in psych nurse practitioner. That's totally geared towards mental health. So when you go get your fundamentals, it's med surge, it's OB. There is a psych rotation. There is, we have 4 med surge rotations. I hated it, but it's done. Sometimes you can get a little specialty. I think I shadowed a dialysis nurse for a day. And some people were able to go into the ER. But yes, you do have classes for that, but it's not like your whole curriculum in mental health. You'll get a piece of it because they want you to see each little part. So thanks for that, Rochelle. Okay, so number 5 is health coach. So with a health coach, nurses that have some type of experience under their belt, we have a knack for wellness coaching because what do we do every day? I want somebody to chime in. What do we do every day when we're at work as a nurse? We are talking to our patients. We're doing what? Somebody put it in the comments. Of course, we're giving them medication, but we're doing what in between that whole aspect? Of course, we're talking. Talking is a part of what I'm trying to get people to answer in the comments. But what are we doing? What does a nurse do and a health coach do? It's pretty much the same thing. We're educating. So you want to educate your patients, but you educating them in lifestyle changes. If there's any type of wellness that's needed, and you can also be a consultant for an insurance company or some type of corporation, but you have to put yourself out there and you got to do your own legwork. Okay. A lot of health coaches have individual patients and they have a slew of them. So they'll have them to pay, for their input so much, maybe a month or a 3-month plan, or just have a lot of clientele. So this has the potential of giving you 6 figures 100% if you got the grind and if you can link up with the right company so that they can just have you to go out to their people and you get paid by that. Okay. Number 6 is something that I was always interested in, but I didn't know how to get into it, is legal nursing consultant. Yes. So, of course, as a nurse, we see a lot of stuff. What was said to me in fundamentals when I got my associates was, if it's not documented, it's not done. So with legal nursing, the RN, they analyze medical records and offer expertise to these legal cases for these attorneys. Now, this is pretty much, if you're good at what you do, you can write how much money you gonna make and just give it to them. Like, if you want me and I can give you X, Y, and Z, I need to make this amount of money. Sometimes these legal agencies already have a dollar amount that they want you to have. And sometimes it's okay to look at their offer, and if it's too low, negotiate. Because if they need you, they'll do some pulling. They got you. Okay, so definitely legal nurse consultant can make over 100,000 K. I'm telling you, this 100K job, this right here, when you get the right people, when you're lined up with the right company, you can make a lot of money. And the majority of the time you're looking at charts, this is not going to be paper charts. We're not doing paper charts anymore. I mean, maybe a couple hospitals still do that in 2024, going into 2025. But mostly everything is on a computer. It's electronic. So this is definitely a work from home job that will pay you a good amount, but you got to grind to get that money. When you get it, you good to go. When you're signed up with the right agency that has healthcare cases, you straight. Okay. So another one I'm going to talk about, number 7, is a utilization review nurse. So with the utilization review nurse, sometimes this is a part of case management and sometimes it's separate. So with the utilization management nurse, I believe the positions that I've seen, pretty much all of them are remote, all of them. And the reason why is because what they're doing is you're reviewing medical records, right? And with these medical records, you want to make sure that they're aligned with insurance. You want to make sure that you are helping the hospital to not go over their budget, because if, say, a patient is there for X amount of days and it's time for their insurance to stop paying after a certain day, you have to see if it's anything new that's going on, and if not, and the patient is refusing to leave, you have to break down what the cost is per day based on what the insurance will not pay and see if they still want to stay in a hospital. Some, as a case manager, as a travel case manager, I've been around patients where they didn't want to leave the hospital. They wanted to go to a particular place, and that place was full. So they demanded, I need to be here until this place opens up. And that's not always going to be the case when it comes to them getting more rehab, unless they're trying to go home and get home care. But the people that usually are having the fuss are the ones that don't want to go into this nursing home, or they don't want to go back to their group home, and you need to find them another place. And if there's an availability, you have to talk to them and say, hey, you always can transfer out, but we don't want you to pay with so much money out of pocket, right? After so many days, it's on you. Not saying that people pay those hospital bills anyway, but you have to let them know that it's going to be a pricey bill, and it kind of puts a little fire up underneath them. But utilization management, in my encounter with them, they will call the case manager and say, well, this patient, within a couple of days, the insurance won't cover unless there's some type of change. So we had a morning meeting with the manager, with the case manager, with the staff. We'll do bedside rounds to see what's needed, what has changed, and if they're ready to go to a rehab facility. And then there are positions where it's remote, where you're doing case management and utilization management for a hospital, and you're doing both. So you should be getting 100,000, period. Okay. Let me see. What am I missing? Noah. Do nurses with PhDs call themselves doctor, or is that frowned upon in the setting where MDs and DOs are present? Yes, they do. I actually have a couple of people in management that I know, and their names are Dr. So-and-so, and they're nurses. Yes, they got their doctorate in nursing. So yeah, it's not frowned upon if they're not, the MDs, the DOs, they have their own patients. But you can't take away someone's title, their certification, because if you went to school to get your doctorate, you a doctor. So no, it's not frowned upon. It's plenty of doctorate in nursing that I know, and we call them by Dr. So-and-so. That's their title. Okay, let's see. What were we on? I'm going to go to... Hold on, I don't know what's going on with this one. I don't know what that is. I'm going to put that on timeout. Okay, so let's go to number 8. So number 8 is a nurse educator. So with education, which I really wanted to get into, but I'm kind of on the fence of if I should go with leadership. I've been a leader. If I should go with nurse practitioner, or if I should do education, because I like all of them. I guess it just depends on how can I expand myself where I currently am. And to be honest, leadership is not it, because I don't like the way that they do stuff there. It seems like the leaders are not really, I'm not going to get into it, because it is a couple coworkers that I know that follow me on this channel. So I'm going to be quiet. But yeah, so nurse educator online. So once you get your master's, this is something that you definitely have to have your master's in, or your PhD. You can teach online. So a lot of the schools that want you to teach their bachelor's nurses require a master's. Now, if you want to teach and you don't feel like going back to get your master's, and you're a registered nurse, you can go to teach LPN classes or CNA classes. You can teach those because you're not required to have a master's. But in order to teach bachelor nurse classes or associate degree nurse classes, you have to have your master's. Now, it seems pretty easy. You go online, you have so many students that are, maybe that's 10 to 15 students that's doing discussion board posts, writing papers that you're going to review. They may have questions, but you're reviewing their work. It's when you're teaching a bachelor level with a master degree, when you're teaching that, all you're doing is paperwork. So you're reviewing what they've done. You're not doing clinicals unless you go to a university with no degree at all. You start off from scratch and you're going from zero to nurse with a bachelor's. When you start off with zero from nurse with associates, that's where you're doing all your clinicals. When you go to another school to get an extra year of classwork, because that's what it was for me. It only took me 3 years to get my bachelor's. 3 years total school to get my bachelor's. When you go back to school to get that extra amount of time to get your bachelor's, it's all papers. Papers, discussion posts. And to my understanding, when I was in NP school a couple years back, that I'm no longer in, it was pretty much the same. You had to do a little bit more, maybe some PowerPoint, some case studies, things of that sort. But in order to teach for a nurse educator, yes, you have to have your master's. Yes, you have to have your DNP or your PhD in nursing. And of course, they want you to have teaching experience. So if you don't have teaching experience and you want to go into being a nurse educator, you better go to a community college, become an adjunct facilitator. You need to pick up some students and do some clinicals, something like that, because you got to have some experience. So if you want to teach online, you got to be able to teach in person first. Unless the school is really desperate or they're brand new and they want you to just help them start their school, that could be a way, but I would go to an accredited school. But yeah, so you definitely have to do that. If you don't have teaching experience, like I said, teach a couple of classes, even if it's clinicals, to maybe a LPN school or something like that, or a CNA school, and be that foundation for them so that when you are ready to go online with your master's or your PhD to teach those students, on your resume, what do it say? I've already done some teaching. So you good. And you don't have to go full time to do that. You can do part-time teaching while you work your experience up. So when you're ready to do that online, you good to go. Okay, number 9 is a nursing director. So not all directors are remote, but we all know the directors make coin, okay? A good amount of coin. So whether you work in person or you work remote, what the directors pretty much do is they oversee the nursing team's policies, any type of remote health services on a high level of management. So as a director, you know that you're above, right? Usually the directors, Noah, if you're still watching, have those PhDs in nursing or the doctorate in nursing. Usually the directors up there, yeah, they're not working as just a regular assistant nurse manager. No, they up here director because they had a credential and they put in their time. So the director is here. Then you have nurse manager. Then you have the assistant nurse manager or nurse supervisor, or however. The assistant nurse manager and nurse supervisor are interchangeable in some places, and that is something that I have already completed in my nurse journey, that it was okay, but I would prefer to level up from that because everything falls on you. You are the stand-in when your boss is not available. And depending on how your boss is, it can be a headache because when I was that nurse supervisor, they wanted to call me before her. And I'm like, okay, I'm not getting paid as much as she is, but it's okay. I'm getting my experience in. So definitely with the nursing director, you're going to get premium pay, especially if you have that premium degree. Okay. Because they pretty much want you to have your master's in nursing or your MBA, okay, master's in business administration. Okay, those are preferred. They want you to have some type of management experience 100%. You can't go in to a job asking to be a director and you've never been in management. They're going to laugh at you. They probably not even going to call you back. They're going to pass your resume up and go to the next one. So I'm telling you these jobs so that you can be ready when it's your time, so you can get 6 figures. If you're not getting them right now, you will be. All right, let's look at the last one. Now, the last one does not require a master's. It does not require a doctorate or PhD in nursing. It does not require an MBA. But these people have the ability to make a lot of money. Okay, so pharmaceutical and medical device consultants. You know what? There's a lot of consultants in here. A lot. Because when you were consulting, because I think, let me see, Rochelle mentioned consulting. When you put consultant or consulting behind the title, you making more money, especially if you experience and you got the right credential. You definitely making more money. So with pharmaceutical or medical device consultants, of course, you don't start off with that. There's a particular one that I'm really cool with at my job. He was in physical therapy school. Yeah, he was in physical therapy school, and he came across this job and was trying to figure out, okay, it's so much money to be a physical therapist. He was a physical therapist assistant first, and he was going to school to be a physical therapist. And he's like, okay, it costs X amount of dollars, but the job doesn't even pay how much I'm spending for school. So he came across a medical device company, and I don't know how long he's been doing it. His girlfriend is a nurse at another hospital, and I think I was asking him, because I like to get information on this, because it may be for me, it may be from somebody that I know, or it may be for me to give to the channel. He was saying that his assistant, like if he do really well and he gets an assistant, his assistant would make, what did he say, about, it was either 70 or 80 grand, his assistant. And I was like, oh, because I was asking, just joking. I'm like, oh, well, do you need some assistance? Can I be? And he said, well, if I do really good, my assistant can make 70 to 80 grand. I'm like, that's a pay cut for me. But it's good to know, that I didn't ask him what he made, because people are particular about what they make, or, if anybody else knows or whatever. Me, I don't discuss my dollar amount to my coworkers, because everybody is paid differently based on their experience, based on their degree. And for him, he was just saying that, because I'm like, what, do y'all hire nurses? He's like, yeah, we do. But it was no openings at the time. So for me, I'm always going to network, because you never know when you need to reach out to this company or give your resume if they have an opening. If it's worth me going to that route, then I would, because that'll be something for me to learn more of. To be honest, I don't think I'm going to go into any type of medical equipment or pharmaceuticals. I also know a gentleman that I went to college with, and he is now a pharmaceutical rep. So, he'll come in with a suit, or he's actually bought some of my scrubs. So he'll come in with some petty scrubs, and he will, talk to the people. And he said, actually, when he comes in with scrubs, people are not intimidated than when he come in with his dressed apparel. So, these jobs, pharmaceutical, medical, I mean, you can make a good amount of money and you don't have to be a nurse. If you say you're an associate degree nurse and you burnt out of patient care, start looking into some of these pharmaceutical reps or these medical device agencies. You might be able to get there. For me, I don't really care for selling or pushing pills to doctors. Myself, I don't even take any medicine. If anything, I'm taking vitamin D with K2, or I'm doing elderberry or beetroot, stuff like that. That's natural, that's healthy, that'll keep my body together. But I'm not on any prescription medication. And I'm trying to keep it that way by keeping up with myself. But the thing is with medical devices, there are some good devices out here that will help you to relieve pain, that will help you to relieve back pain, headaches. It's equipment like, well, I'm not even gonna put them out there because it's not a paid thing, but it's a lot of stuff out there that can be helpful. And the good thing is, when you talk to these doctors and they want to do something for their patients, it's just a simple little order that they got to put in, and then the pharmaceutical or medical rep will send that stuff to them, or they'll probably already have it at the hospital. But I'm saying, when you get good, if you want to grind and you don't have the credential, definitely look into pharmaceutical or medical device consultant. That right there will get you some good money. So if anybody have any questions, feel free to comment below. But I went through the 10, and I'll do a quick recap while, if anybody wanted to write something, feel free to do so. So number 1 is nurse practitioner, telehealth. That's a given, right? That's number 1. And these are not in the order of how much you'll make, but they all will give you 6 figures. Number 2 is a clinical documentation specialist. Or you may hear CDI, clinical documentation. I forgot what the I was for. I'm sorry, y'all. Number 3 is nurse informatics. Number 4 is case management. Number 5 is health coach. Health coach is something that you have to put in some footwork for 100%, but you can get that coin if you're ready to grind. Legal nurse consultant, another one you got to put some footwork in, but when you get it, you good. Number 7, utilization review nurse. That's at hospitals. That is at insurance companies. You don't have to grind for that. You just apply for it and have experience. You good. Nurse educator. Like I said, if you don't have any nursing experience with education, you need to get you a little part-time job for the weekends or something to where you're teaching someone. If you have your bachelor's and you want to teach associate's degree nurses, go and pick up a clinical, do some adjunct teaching, and you can have your clinical group. I think it's not even a lot. Like back then, I believe it was like maybe 8 students. Or less. I don't think they bombard you with a lot of students, but correct me in the comments if I'm wrong. And then you would take care of them for whatever amount of hours for that day, as well as you're showing them the right things to do. Tell them why they're giving this medication. Explain that they need to tell the patient what this medication is and what it's helpful for. All of that. That's a part of the foundation of nursing. Nursing director. That is like I said, you got to have your MBA, your DMP, your master's. You up there, okay? It ain't no associates or no bachelors as a director, unless you at a nursing home and they're desperate. Because I've seen a director of nursing for an associate's degree nurse that worked at a nursing home, and that's a setup for failure. So be careful when you're getting a job offer for a director of nursing in a nursing home and you're not even that seasoned of a nurse. That's dangerous. Of course, she didn't get offered $100,000. I believe she got offered $80,000. But as a new nurse, that amount of money was appetizing, and I believe she took it. I believe she's still a nurse, but I don't know where she is now. We graduated together, but I wouldn't have did it because no, that's a setup for failure with some companies. They just need to put somebody there, and being in a job as a director without the experience, that's the quickest way for you to lose your license, go crazy because you don't know all of the stuff that you got to do. And it's just a lose-lose situation, but they entice you with that amount of money that you make. So be careful. Not all high-paid jobs are for you. And the last one is the pharmaceutical or medical device consultant. You can look at all of this stuff on Google or any other search engines when you're looking for jobs. They out there. You just got to know the names. And I gave you the names and I did a rundown of what the names are. So hopefully this is helpful. I'm pretty much, I don't see any more comments, but I'm pretty much end it if nobody else has any questions. And again, little plug, shameless plug, my scrubs are 50% off for Black Friday. So I linked it in the description. Click on it. It's 50% off at checkout. I have a few men's scrubs as well as women's scrubs, accessories, compression socks, badge reels, badge cards, scrubs with jackets. And the majority of the time when you see me in scrubs, when I'm doing my green screen, those are mine. So take advantage of the sale now. It's pretty much, my stuff is going to be on sale all the way through Cyber Monday. But I want you to make sure you get the size that you need because they're going like this. Because when I come up with a new color, like I came out with pink, my coworkers grabbed so many of them. The available sizes left was minimal. Like I think I only got small and like a 2X. But I wish y'all a wonderful, wonderful Friday and a good weekend. Hopefully y'all didn't go broke Black Friday shopping. I know I didn't because I only had a couple of things that I wanted. But y'all have a good day. Be blessed, y'all. Bye.